Okay, so this is your letter. Okay, I'm going to start reading it now. So admitting officer, emergency department. Okay, so emergency department, that's fine. Then the children hospital should be written on the next line. Then Newtown on the next line. This is how you're going to write the initial four things. Then about the date, see, whatever the date is written in the case notes, please write that date. If you won't write the date that is given in the case notes, you are making a huge mistake because you will not be able to, write a proper letter. So the date should be according to your case notes, not according to your the day you are writing the letter. For example, this is the date 03/05/2025. And if you go down and somewhere you might be writing the date, okay, if we go back, okay, and somewhere in the letter, this date might be, different. If you see, this letter was written in 2013. You are writing, you are referring this patient 12 years after. Is that making sense? Okay, it's not making sense at all. Whatever is, so if there is a 2013 year and you are writing date of 2025, so you're already gone. Your letter is already, messed up. I don't need to read other things. The reader will just look at 2025 and inside the case note is in 2013. So he will say this doctor doesn't even know a basic thing. So why would I give him 350? He will right away cut your letter, move to the next part. It doesn't have time for you. Okay, they need money. Okay, if you do these sort of mistakes, these are very basic things we have to avoid. And I have, addressed all those things in the basic letter, in the basic, class. And I ask you to watch that particular class twice. Still, you're making these mistakes. Okay, so don't do that. The next thing is here, if you come a bit forward, it's their dear admitting officer. In my, a basic writing class, if you remember anything, was there any line that I mentioned about dear admitting officer? There was nothing like dear admitting officer. You have to write dear sir or madam. Okay, dear sir or madam should be written over here, not dear admitting officer. Okay. So these are very, very, very basic things. If you keep on making these things, I'm not going into details at the moment. It's like fourth, fifth letter now, and still we are stuck on those things. So, these are very, very basic things. That's why I'm recording and uploading letters for you. You can go back, watch those videos again and again, so that you can, learn from your mistakes. If you can't, then there's going to be a problem. Okay, and I can't emphasize more than this. So what should have been written over here? Dear sir or madam. And then there should be a comma. Okay. Then Joshua Venice, after that, there should be a comma. I mentioned in the last letter as well. Okay, in between DOB and the name, there should be comma. And after date of birth, there should be, if this is date of birth, first of all, there should be comma over here. Then this is the ideal way of writing it. So it might seem very small mistake, but I mean, you're spending 1 lakh, 10, 15,000 rupees on a test, and you can't afford these small mistakes, and later on, if God forbid the results are not in your favor, then what would you do? You will think that, I wish I could have done it better. So I'm telling you how to do it better. Please do it better. If you're not understanding, do let me know. I can tell you 1000% 10 times. Okay. And I will have no problem with it. But please focus on these. I can't emphasize more than this. I'm keep on emphasizing from last 4 or 5 letters, and still we are stuck there. Okay, we are still there at the very start. Then comes up the purpose. The purpose here is I'm writing to Rafa Joshua, okay, for rehydration and further. See, I told you how to write the purpose. The problem is you are not following the way I have taught you, and that's why you're making a lot of mistakes. Now, it's difficult for me at the moment to understand whether you are not getting my point or whether you are unable to write it down even after, understanding. Okay, so exactly, I'm not, understanding why this is happening even after fourth, fifth letter. So could you please tell me, am I making sense now to you? If there is any
Yes,
problem,
sir.
if there is any
So,
problem that you're facing, if I am saying something which is not understandable, do let me know. I can repeat it 1000 times, but we have to get rid of these mistakes. Okay, but because if you keep on making these mistakes, I'm not, see, it's been 5, 7 minutes. I have just read 6 lines of yours and I have identified, identified a lot of mistakes out of it. So what do you think the reader who is going to read and assess your letter on the day of your exam, do you think he will not notice these things? He will notice, or she will notice, and then they will not go forward. Okay, they will right away. If your purpose is gone, if your purpose is not appropriate, they do not need to read any further. This purpose is very, very poor. Okay, so if it is poor, how can I now, if I'm a reader and if I'm assessing your letter in the exam, I won't give, any more attention to anything else, whatever you're writing. I'll just give you 250 and move forward. Why would I care if you don't care? You following me? If there is any problem, do let me know. Till so far, if you're not able to understand me, if if there is any problem, do let me know. We will move forward after that. Once we will sort out those things. Am I making sense, doctor?
yes, sir.
Yeah. So is there any problem? Whatever I'm telling you, are you understanding my
No,
point?
okay, sir, I understand, but there are different types of letters, so I get confused on
No.
these.
See, that's why in the basic class, the way I have taught the basic class, I can assure you, you can Google, you can, gather 1000 tutors, okay, and you can ask them to teach you the way I have taught. I'm not saying I'm very great or something, but that is the most easiest way of writing these letters. From last 3.5 years, this is the syllabus that I'm teaching, and I can assure you it is not outdated. I keep on following the official OET to if there is any changes coming up. So we do follow up with that. From last 3.5 years, 1100 plus students have passed with the similar lecture that I given to you. Okay, and 1100 means this is the record. None of my student has failed or have failed in their writing part and speaking part. I cannot claim more than this. So if the 1100, this is the streak that's going on, and I can't and I don't want to break it. And I can't, I don't want you to break it. Okay, please follow that. Whatever the type you are writing, just follow that structure. I can assure you, you will pass, inshallah. Okay, because it is if it works for 1100 people, why will it not work for you? Are you following? It's not about different types of letter and stuff. I have made that lecture, designed that lecture in a way that any type of letter will come in it. Okay, and any type of letter will, go with that particular template that I've given to you. So you don't need to change anything. Just follow that, please, for God's sake. Are you following me? Hello? You following me?
Yes, sir, I am busy. Wait
Yeah,
for
okay.
you can record.
Yeah, yeah. So just follow that. Okay. If you want, I can send you that particular video again, watch it again. Just follow that religiously. I can show you, inshallah, you're gonna make it. Okay, but don't go here and there. Don't think, I have to write a letter in a particular way because it is of a different type. No, just follow that. Follow that blindly, I can assure you will pass. If you won't follow that, then I can't guarantee anything about that. Okay, but that's the thing I really want to emphasize, and that is the reason I have arranged this class for you specifically. I've taken the other class for other students already. This particular class only for you. Okay, because you join late, I don't want you to miss out anything. But please focus on these things. How you should have written this purpose. Listen to me. I'm writing to refer Joshua, okay, who has presented with signs and symptoms suggestive of mild dehydration and constipation. Your urgent assessment and management would be highly appreciated. See, I told you in the again, the basic class that whenever you're writing a letter to emergency department, that is going to be what? Urgent referral letter. So the purpose is already gone. You don't even know the type because you didn't focus on the emergency department. The word. I told you these are the hints. It means you didn't, you know, watch that video properly, or maybe you didn't get it, properly. That's why you're missing these things. Okay. So that is the purpose you have to mention and you have to write. Okay. The next, Joshua is 8.5 week old child brought to me by her mother, complaining that Joshua had not passed school since last 5 days with no wet nappies today. Okay, now this particular paragraph, so how many tenses you have used? Joshua is 8, now it is the present tense, then brought is a past tense, then again Joshua had not passed, that is also a past tense, then you have mentioned Joshua has one episode of vomiting. So you're using simple present, simple past, past perfect, okay, or past perfect continuous, I would say, and then you're using the past perfect, present perfect. So you are using four types of tenses. I would say like in a single, what to say, single paragraph and even 4 lines. So that's a huge mistake. Okay. I again listen to me. Whenever you're writing the previous visit, the past visit, past is past. Past means past tense. So you have to write in past tense. You can write with a was, were, had, these sort of things. Whenever you're writing present visit, today's visit, you have to write what? You have to write present tense. Present is, am, are, has. These are the present words or the helping word that you have to follow. Am I clear so far? I, are you are you there?
Hello, sir. Got back?
Yeah, I am there. Can you hear me?
Yes, I hear you, sir.
Yeah, okay. So then that's not the way. Okay, the paragraph again. Joshua was brought. There's no need to write he's 8.5 week old. Okay, just write Joshua was brought to the hospital by her mother as he was not passing stool from last 5 days. Okay, that's the way. He also had an episode of vomiting. If it is a present, then write in the present tense. That's simple. Okay, then on examination, Joshua was mildly dehydrated with dry mucous membranes, tissue turgor, and capillary refill. Tissue turgor and capillary refill is what? They are increased, decreased, normal. Okay, they are on moon, they are on sun, they are on earth. Where? What? Tissue turgor and capillary refill. It is not mentioned what happened to these two things. So it is half sentence that you have mentioned. It is not showing any information. Okay, or leading to maybe you know towards some other side. So that's not the way to write. So either they were decreased, right? So they should be decreased, right? So tissue turgor and capillary refill time was decreased or increased. These two things could be there, right? But in this case, it should be decreased because he has right dehydration. Then abdominal examination, on abdominal examination, mild generalized tenderness were noted, or sorry, was noted, okay? On routine checkup at 6 weeks of age, just write on Joshua's routine. See, again, I told you, whenever you are going to start a new paragraph, the first line should contain the name of the patient. Okay, so on a routine checkup or on, a routine checkup of Joshua, his mother complained that he had passed little hard, just like passed hard stool, or he was passing hard stool once a day or once, every 3 days. Once every 3 days. Okay. His examination was unremarkable. Okay. There is no comma after last 3 days. There should be full stop, and then you have to write his examination was unremarkable. Therefore, his mother was advised to express milk with boiled or warm water. Okay, that's it. However, on reviewing after 2 weeks, he was still having hard stool, along with complaints for crying while waking up and pulling legs and chest. The problem is that there are so many mistakes that I can't tell you at the moment. But that's definitely not the way to write a letter. Okay, we have to improve, because if we won't improve, then things are going to be, things are not going to be in our favor. Now this, however, on reviewing after 2 weeks, this is the next visit. So just write. See, in your whole letter, you have not mentioned any date. When did he came up? Okay, when did he come up? When did you start the treatment? What happened on which date? Whether it was the first visit or second visit? What is today's visit? When are you referring? When are you? So these things are not clear. If they're not clear, they are not going to pass you. In this letter, if you ask me, I'll not even give you 200 for it. So 350 is way more, higher score for this. Okay, so I'm really not satisfied. I hope you're following me, whatever I'm explaining to you at the moment. Okay, if you see, this is the picture that, this is the letter that we are following. So the routine 6-week baby check, that was on 31st 12 2013. So you have to write on 31st 12 13, Joshua was brought into the hospital by her mother as he was concerned regarding her bowel actions, or as he was passing one bowel, or as he was passing one stool every 3 days, or just write as he was passing stool every 3 days. All of these will make sense. Okay. He was also, the rest of the things are normal. Okay, stools were a little hard, you can mention it. Making wet nappies, feeding well, demand, feeding, sleeping through them. So everything else is normal. Then just talk about examination. Examination is also normal. So yes, right, his examination was unremarkable with weight of 3,900 grams. Okay. Therefore, his mother was reassured regarding the variable bowel habits in the infants. Okay. And she was advised to express milk once a day and give it in a bottle with some warm water. That's it. That's how smooth the information should flow. I hope I'm making sense. Are you following me so far?
Yes, sir.
Yeah. Okay. So these sort of things, we have to be very, very vigilant with these things, because if we make the very, very, like, as I mentioned, I'm not going more in deep at the moment. First, we have to, focus on the basics. We have to get done with the basics first. If the basics are good, then we can, think about, okay, this is the mistake. This is more deep thing, we can avoid this so that we can get 380 plus. Okay. But at the moment, we are talking about 350. And for getting 350, you need to get done with the basics first. If the basics are good, you will be able to get 350, 360. And that's good score. You just have to pass. You just need B so that you can, move forward. But once the basics are set, then we will talk about how to get 380, 400, 390, 420, these sort of things. So first we have to, make sure that at least we are getting 350. Okay, and all of these things, whatever I'm explaining, I hope you're following me. So this is how we have to write the letter, so that information should flow in a way, the tenses should be accurate. These are very, very basics. I again would like you to watch the basic lecture again, thoroughly make some notes out of it, whatever the letters I have assessed so far for you. Watch those recordings again, because you do have the recordings, you do have the links for those. Okay, watch them again. I will send this recording to you again as well. I'm not going to evaluate the next letter for you. I want you to listen to this, watch this particular recording and the other letters and the basic again, and write the next letter that you have sent me already again. Then tomorrow we will compare. Okay, the similar letter that you have written before this class and the letter that you have written after this class. So we will see if there is any difference or not. Then we will identify whether I was able to convey the message properly or you were able to get it or not. Okay. And whether I was not able to convey it properly, so that I might change my method to convey the information to you. Okay. It's not necessarily that you should get every point out of me. Okay. It's okay to sometime lose some focus and then come back, and I have no problem with it. You can ask me 1,000 times, as I mentioned, and I will be there to help you out. But we have to analyze what's going wrong. Okay, whether my information is not good enough for you, or whether whatever I'm speaking you are not getting out of it properly. So I want you to write the next letter again. I mean, not the Joshua's one, but the next one. This the Allison Gray letter. Okay. So this letter is there, but I want you to write it again, because see, there is again the problem with the date. I want you to improve with these things. Okay. So tomorrow we will do another class, same time. We will analyze whether whether things have been improving or not. Okay. So this is all about the letter writing. Now let me talk about the listening and reading. Okay. So then let me just get down with the recording.